What do you wish people understood about your role in healthcare? And you gave us a great explanation of what functional medicine is. Is there something that you wish either your colleagues or people in general understood a little bit better?
So, I mean, I think even with that word I mentioned, let's bring the health back into healthcare. I think we need to bring the care back into healthcare too. So I think we just need to look at the term that we're under, right? I mean, health and care. Let's do a little bit more of both of those. And that's what I try to do for my patients. And that is what we do. And it's a sacred responsibility to me and my team to really hold space for these people, meaning like really listen to them and give them the attention that they need, validate them, because many of them are delegitimized systematically for years, then told they're just basically crazy for having these different autoimmune problems. And if they just did what they were told and take this medication, they'd be fine. And they're doing that. They're taking the medications and they're not fine. And they're maxing out the medications and they're not fine. Or maybe it's managing their symptoms, but they're not in health. They're just disease managed, which is better than being unmanaged. But then there's an alternative. It is actually reclaiming your health. So what I've done for the past 12 years is just be of service to my patients. I just focused on my lane. I'm relentless in giving them the attention that they need. And occasionally I come up for air and talk on podcasts like this about this stuff. But it really is just a very much an immersive experience that's needed, because there is, and I'm just a very small tip of the iceberg of what needs to happen, because I'm talking about individual people's lives and improving their health. And maybe that's the way it needs to be, is sort of a grassroots effort. If enough physicians say enough is enough, let's get out of our own tribal war and say, let's be of service to people instead of be of service to some indoctrination that we have, but really be okay with learning and be okay with evolving, be okay with pivoting and saying, just when you know better, you do better, I guess is the Maya Angelou quote, is just saying, let's learn and get our ego out of the way, is I guess what I'm trying to do for healthcare, at least when I'm talking about it, I guess, on podcasts like this.
Yep. So it's interesting. I love what you're saying about getting the health back into healthcare, getting the care back into healthcare. I've got a presentation coming up next week, and it's called Health Patient Care. And the reason is to put the patient back in the center of healthcare. So
I
I
like
think
that.
there's a three-legged stool there, that it's got
Yeah,
to be about health,
100%.
it's got to be about care, but it's also got to be about the patient.